Hey, welcome to another episode of Your Faith and Health Community. I'm your host, Pastor Jackie Jackson. And as always, on behalf of myself and our producer, Anita Alexander, we want to thank you very much for taking out time from your day to spend with us. Now, before we jump into this show, you know I'm going to talk about healthcare. Every time I see you, or you see me rather, I'm going to talk about healthcare. You know you need to get health insurance. If you have not gotten health insurance yet, you know you missed open enrollment, which ended back in December. But if you have recently started a new job, recently lost your job, gotten married, divorced, had a baby, returning home, re-entering back into society from a jail or a penal institution, recently moving into the state, those are called life-changing events. And if you've experienced a life-changing event, that makes you eligible, if you are for marketplace insurance, to enroll. You have 60 days from the date that your life-changing event starts in order to enroll without receiving a penalty. Well, wait a minute. The penalties are gone, aren't they? I'm sorry. We're not even worried about a penalty anymore. But there is a penalty if you don't have health care. You have to go to the hospital. The penalty is that you can't get the health care that you need, which means that your family is going to suffer. So if you don't want to get health care for you, get it for your family. Make sure you can go to the doctor. Make sure you can get preventative care treatment. It's good for the emergency room, doctor's visits, vision, dental, all of those good things. And if you're single, making $16,248 or less a year, that makes you eligible for Medicaid. In fact, you can't even go to the marketplace. You would have to go to Medicaid, which is good because that will cover all your medical expenses, all your emergency room expenses, doctor's visits, preventative care, vision, dental. If you're like me and you wear glasses, you know how expensive they could be. So listen, get enrolled in some health care. Don't wait around. Don't wait until you're there and wish you had it. All right, I'm going to get off this because I want to get to my guest, Mr. Ali-Rashid Abdullah, who I also work with as a part of the Community Outreach Advocates. Welcome to the show.
Thank you.
And I'm used to calling you Rashid. I've said your official name. Now I'm going to go back to calling you Rashid, if that's okay.
Good.
So you're here today because we're talking about trauma. And trauma is something, given this day and age and all the things that's happening in our community here and around the country, trauma is something that is springing up. It's always been around, but it's springing up more than ever with the shootings, with the mass shootings, with what's going on in government, with what's going on overseas. There's trauma just going around. And so you and Dr. Garcia and a number of others are working on a program that I guess you're about ready to introduce it officially into the community around trauma. And I just want to real quick, I obviously went online and pulled up a definition for trauma. And trauma is the psychological upsetting experience that produces an emotional or mental disorder or otherwise has lasting negative effects on a person's thoughts, feelings, or behavior. And again, like I said, when you look at all the things going on in our city and our country, around the world, there are things that for people who may have never experienced some of the levels of trauma that they're experiencing now, it's becoming rampant. So why don't you just tell us about the program, or is the program the right phrase? The trauma treatment or the trauma program?
It's an initiative.
Initiative,
you know,
okay.
And what has happened is, working with the community outreach team for the last 10 years, we have worked directly and indirectly with a number of crime victims, families who have lost loved ones to gun violence, children who have lost their fathers. We have been involved in numerous settings where there are bodies laying around, and children and adults that are present who we realize don't really know how to process that loss. They don't know how to process the grief that they experience from having known this person. Mothers, it's a very traumatic experience. Fathers, whole communities. Very recently in the Winton Hills area, we saw a number of children who were coming home from school. from Winton Hills Academy who witnessed a body laying out in the street, you know. Of course, they didn't know who the guy was, but what they witnessed was the trauma of the mother and the aunts and the uncles and the cousins and the people who were witnessing the body of someone they loved laying there who they couldn't touch because it's now a crime scene. We witnessed mothers, adult mothers, who to them it appeared, well, it's happening so often, it just is what it is. But what we know that eventually people who are traumatized, if that trauma is not addressed, if it's not dealt with, it will manifest itself later on in that person's life. And that's what we're finding in the behaviors of so many of these young men and women around the city of Cincinnati. So what we have done is we went to Dr. Victor Garcia and Chief Isaacs, and we went to them and we asked them to help us to help create an opportunity to address issues that have been long-standing particularly in the African American community, but many other communities, to address the trauma, to address the reasons why we are creating in our homes children who have a attitude and a disposition where they care about nothing and care about no one. They have no fear of God. They have no love for family. So we're trying to get to the root of why and how it is that we're creating these type of children from our homes. For the most part, these are our children that are getting killed in the streets of Cincinnati, and these are children that are doing the killing. So it's imperative that we do something about it.
Okay, and so in developing this initiative, you said it kind of sparked up in you, because my understanding, and correct me if I'm wrong, this is born of your idea, and you were able to reach out to professionals. And just to make it clear that you're not a doctor or a psychologist or psychiatrist or...
No, I'm a victim. You know, I've been victimized by trauma. You know, I've lost loved ones, I've lost friends. I found myself in situations, helplessness, where I didn't know what to do. I've watched people die in the street. And I'm a victim as well as an observer. But people do a lot of talking, and what we do, the outreach team, is we try to come up with solutions, you know. And the solutions begin with the individual people in the community who, first of all, who are hurting. First of all, recognize that it could be their child next, because it could be anyone's child. Children, your child doesn't have to be in the street selling drugs or doing wrong things to become victimized by what's happening in the streets. We have an incident very recently, a couple of years ago, where people were out at a nightclub enjoying themselves, where two guys who had beefs with one another began shooting. 17 people were shot. 17 people, 15 of those 17 people had absolutely nothing to do with that beef. So it goes to show that you don't have to be involved in anything, any criminal activities, to get shot or to get killed. And what happens is these people leave. You have many people now who won't go to nightclubs. You have many people, when their children talk about going, their parents are very anxious. They're very concerned, because they realize now it can happen to their innocent children. So what we're trying to do is address what is taking place, the reality of what is taking place in our community on a regular basis. Most people are familiar with post-traumatic stress. Most people are familiar with the idea of soldiers coming home from war. After being at war, witnessing and participating in shootings and killings, and coming home trying to readjust to this society. You have, I believe, 10 to 12 servicemen committing suicide every day because of their inability to adjust to what we consider normal society. In the African American community, in the poor communities here in Cincinnati and around the country, we have children, we have adults who are not only dealing with the shooting, the homicides, the robberies, the rapes, every day, not just what took place yesterday, but what's happening today, knowing that it's not going to be addressed by professionals, and they got to find a way to cope and deal with it tomorrow. So if you never address these issues, all of this combination of so many things that these people are confronted with, it will manifest itself, and that's what we found.
And so you're also looking at people who don't even realize that they're affected.
It's called vicarious trauma.
Vicarious trauma. And then you're looking at a case, if you see a shooting on the news, it gets attention. So it's on the news and you're paying attention to it. You watch it. You know the victims, you know the situation, you know the circumstances. Then it moves on to another story. And when the news moves on to another story, we kind of tend to tag along and forgetting that there are victims that are involved and their life continues regardless to what the next news cycle is. This past April, I was in D.C. because I am a surviving fellow with Everytown for Gun Safety. And so we were the new fellows for 2018. We went to D.C. for a training. The thing about that was I met people from the Pulse nightclub shooting who were victims, from the Las Vegas shooting that were victims, mothers who had lost their children, individuals who were affected by different gun violence, and also something that a lot of times people don't understand or know, and I didn't at one point, that even suicide, when you use a gun for suicide, that's gun violence. You know, it's gun violence against yourself. But it was a different thing to watch all of these shootings on television, but then to actually sit around for 4 days with individuals who had been there, who had been shot, or who had lost loved ones at some of those shootings, to actually sit and to see the effect that it had. You know, you saw it on television. Once the camera was gone, that was gone. But then to sit with these individuals and actually talk to them and to hear what they're going through, to share my story, but to hear their story, it reminded me that we are suffering, we are hurting inside. And for some of us, we don't even know how to deal with it. Now, fortunately for us, they had, I believe, 6 counselors that were there every day for hours that you could get up at any point and go talk with them if you need it. But like you said, in the schools, they're not 6 counselors sitting there that if you just was at your neighborhood in the weekend and there was a murder that you could sit down with. And then you mentioned post-traumatic stress disorder. And so I just wanted to, and we were talking about this before, and a lot of people have heard about it. I want to talk about just briefly the two, because until today, I didn't realize there were 2 different post-traumatic stress disorders, which I guess it says that myself, like a lot of people, we don't always take the time to understand and get knowledge. So post-traumatic stress disorder is the official diagnosis, or the official diagnosis is Dramatic and Statistical Manual, in the Diagnostic and Statistical Manual of Mental Disorders, it describes a set of symptoms that may be experienced after a traumatic event. These symptoms most occur for at least a month and include re-experiencing the traumatic event. This may involve nightmares, flashbacks, and distress at being reminded of the event, avoidance of trauma-related thoughts, feelings, or situations, negative change in thinking and feeling. And I think this becomes something, if you're wondering if your child or your husband or somebody that you know is suffering from post-traumatic stress disorder, says negative change in thinking and feeling. This can include feeling numb, blaming oneself or others, induced interest in activities, difficulty remembering aspects of the event, lack of ability to experience positive emotions, or feelings of detachment from others. Now, that's post-traumatic stress disorder. Then there is complex post-traumatic stress disorder, and that is a term that is often used to describe the consequences of multiple experiences of developmental trauma. And when you talk about, I think you mentioned the kids in Winton Terrace, or in communities like Over the Rhine, Avondale, Price Hill, where there are multiple shootings that seem to occur over and over. And we know from work that sometimes we see some of the same people at different scenes. So that seems like that would apply to the complex post-traumatic stress disorder. And I don't know how much you are experienced with that or know about that, but I know you're working with the professionals. I bumbled through all of this, but you're working with professionals that know about these disorders, that know about trauma, and are looking at a way to bring help into the communities.
Dr. Victor Garcia created the first trauma center here at Children's Hospital. I think he was brought in to Children's Hospital for that express purpose. They recognized the need to create a clinic dealing specifically with trauma. It's interesting that if a child is killed in a rural area in a car accident, the following day there are counselors at that school. There are counselors there to help those children process that loss, to deal and to cope, to help them develop the coping skills that they need to go on, because life goes on. In the poor and African American communities and many white communities, when someone is killed, when there are shootings, when there are robberies, there is no one there to help that community. See, we're talking about, this is not individuals, we're talking about communities. Communities that are traumatized. Communities that are affected by daily shootings, the threat of homicides, if not homicides, robberies, break-ins, rapes, so many things that are taking place when you're in, for example, the Whitney Hills area, where you have over 800 units. So we're talking about thousands of people that are congested in just a couple mile area. Nothing takes place at the bottom of Winton Terrace that the people up top don't know about. Everybody knows what's taking place in their community. So everyone is affected by it. If you have a group of school children, particularly African American children, from the ages of 7 to 12, and you ask them the question, do they know someone who's been to prison? 98% of those children will raise their hand. If you ask them if they know someone that has been shot, the great majority of them will raise their hand. There are always those who would tell you they know of people or have heard from mama and daddy or auntie or grandma, someone that has been killed from gun violence. It's a very complex issue, but we have professionals. Dr. Victor Garcia has drafted, I'll say, he's involved some of the top trauma trainers here in the country, in the United States. And our hope is to go into these communities and select the right people, the people who live in the communities, first and foremost. People who the communities know, love, and trust, and respect. Because everyone is not going to reveal their innermost secrets. They're not going to reveal their demons to strangers. To train them that they're able to diagnose what is taking place to their children, in their families, even to themselves. To get the help that we need in order to offset, to perhaps even stop a lot of the behaviors that we see 5, 6, 10, 15 years later, 15 years down the line. Many of the same children who witnessed gunshot victims 10 or 15 years are now shooters and being victimized by guns today. The very same babies that we've seen on the street, the children of homicide victims, the children of the shooter, are now become the victims here in the city of Cincinnati.
Let me ask you this. And actually I have a few questions, and I'll start with this one first. You said why why you put this in motion, how this kind of came about in your mind that, hey, we need to do a little bit more.
We're compelled to do it. We're compelled to do it. We're compelled because we find that there are too many people who, when shooting takes place in the communities, first thing they're expecting City Hall to resolve it. They're expecting the police to be there before it happens. That's not their job. That's not what they do. That's not their job. The responsibility must lie in the community, must begin in those dysfunctional families.
But you took on to me, I mean, you've been working on this now for what, over a year? to me, it seems like a big problem. I'm sorry, not a big problem. It seems like a big task. Why did you feel it was something you needed to put on your shoulders?
Well, somebody needs to do something other than talk. We do a lot of talk, and there are a lot of good people who really want to do things, but they don't know how. The city is really, many of the leadership in the city are so divided that they can't agree upon what needs to be done and how it needs to be done, where the monies need to flow. So we want to demonstrate with them what has happened is. We went to the Attorney General's office, and they believed in this so much that they have now granted us monies to begin a process to do trainings in these communities. The police chief, Chief Isaac, believes in this so much that he is now giving us monies to begin a process to heal these communities, to heal these people. It's interesting that we have all of these trauma centers around the city of Cincinnati. For the most part, they don't work. They don't work because you treat the child, you treat the adult, then you send them right back into those environments that are inflicting the trauma. So if you don't address that, sure. So am I running out of time?
Yeah, we're down to about 3 minutes. Anita had flashed, and I don't even think we've really scratched the surface of it.
Right.
And it's not something I want to just let go and let it flow.
Because we got a lot more to talk about.
Yeah, we do. So let's do this. Look, we know you're going to come back next week. We know you're going to come back next week, and that's really great and important. One last question, though, before you go. When will this program launch, or do you have a launch date?
Well, we expect it within a month, within 30 days. You know, we have the monies in place, we have the people in place. It's just about the implementation. But we want to do it in such a way where we know it's going to be effective. We don't want it to be another fly-by-night program. We want this to be something that the people embrace, you know.
So within the next month, we should
you will be hearing something.
We will hear. We should be ready for the launch.
Yes.
And look, I want to thank you again. We want to thank our guest again, Mr. Ali-Rashid Abdullah.
You got that right.
I got it right.
You're right.
And for coming out, and we're going to have him again. We're going to continue this conversation. But I just want to say to you, if you're watching or listening, it's important that for our health. It's important, you know, I always talk about our health in terms of our physical health, but our mental health is very important. In fact, what happens in our mental health can affect what happens in our physical health, because if we're not dealing with it, all types of things begin to happen with our bodies, whether it's ulcers, high blood pressure, trouble with our hearts. So it's important that we have health care. The good thing about health care is it's going to have mental health care involved in it, and it's something you need to do. Trauma is hitting our community, is hitting our city, is hitting the state, the country, and the world. But just talking about our own little part of the community is striking us. As Rashid said, we're out. So we're at the shootings, we're seeing the individuals, we're seeing people, families struck, hurt. My family was hurt. Just a little over a month ago, my great-nephew was murdered in a home invasion. So we're seeing the trauma and the stress hitting. And it's important that you take care of yourself. So listen, you want to tune in next week so that you can get more information about this program that Rashid and Dr. Victor Garcia have, that's going to launch in a month, that's really going to help you, me, and the community that we live in and serve. So until next week, I want to thank you again for spending time with us. I hope you got information that will change your life for the good. But until next week, you stay faithful, stay healthy.